All right, we're over at Microvention, and I'm here with Dr. Jonathan Zhang, and again with Jacques Dion with Microvention, and we're going to talk today about FredX.
Great, thank you, Jeremy. So, Jonathan, how many Fred cases a month, or flow diverter cases a month do you do, and what's your favorite flow diverter of choice?
Well, thank you, Jacques, and for inviting me here. Flow diverters, I probably perform about 3 to 5 cases every month, and my favorite choice of the devices in the past is largely Fred, and since the launch of the FredX devices, I've been have the fortune to use it very exclusively, so that the last 4 months is my main choice.
So talking about the FredX, what could you tell us about maybe 2 or 3 advantages or peculiarities of FredX compared to Fred, or advantages?
Well, what I would summarize, FredX is just the simplicity of its use, and that can be translated into its predictability, the precision, as well as the visualization. And unlike many of the other flow diverters, and what you do is you do not need to position the microcatheter very distally, and where you want the distal landing zone to be, and that's where your microcatheter's distal tip to position it, and as long as you have rooms for the distal wire for the 27 system to land, and once you open up the distal marker, and it will usually stay there, and so it's highly predictable, and then the deployment of the devices is typically very simple and without that much manipulation, unlike the traditionally how we usually do with the flow diverter. And lastly, the double helix marker, making the visualization of the device so much easier compared to other devices. And so I don't need to always resort to dyna CTs or vasal CT in order to see that the apposition with the wall. And the one last is with the introduction of the FredX technology, I've been starting to experimenting shortening of the use of dual antiplatelet therapy, and traditionally I use much longer than these the newer ones.
So you've talked about deployment technique a little bit here. Any other differences in either deployment or sizing compared to other flow diverters?
FredX, just like Fred, it's true to its the specified diameter. So unlike other devices that will actually expand it to slightly larger to the specified diameter, FredX will be exactly if the patient's anatomy measures to be 4, and you use a 4, and if it's slightly more than 4, you use the 4.5. Another major advantage of FredX compared to other flow diverter is the availability of the 5.5 devices. And so in case of patient has a larger carotid artery that's larger than 5 millimeter, it's a very good choice to use.
So moving away from mechanical, what's your standard DAPT regimen?
I usually load the patient with aspirin, Plavix, or Brilinta about 5 days before the procedure, and then the standard dose of the Brilinta or Plavix. I usually test the patient between 24 to 48 hours prior to the procedure, and using P2Y12 Acumetrics, and I use that as the guidance of the performance.
What's your initial clinical experience been with the FredX?
It's just a very simple, easy to use, and highly user-friendly devices, especially for flow diverter, and many of us interventionalists that all know that the steep learning curves usually associated with using these devices. However, FredX usually can make that transition and learning much smoother and shorter.
On the topics of X technology and general surface modification, what are your hopes for these technologies in the future?
I think our dream is to have the devices available on a 17 basis system.
I think those are really good points. You know, Jacques, you've got this on FredX. You have to be thinking about other things you could do with this. Can you talk a little bit about that?
Sure. Well, this is our first initial step, and to date we've had great results for in vitro testing. We also are very hopeful and very happy about the first initial clinical results that we've had with the X surface technology. Of course, there's thoughts of extending that to other devices, I'm sure, like every other manufacturer has. In terms of future, we're going to continue to collaborate with physicians and societies like the SNIS. And also, I'd like to point your attention to our symposium tonight on X technology, which is going to be in the Harbor C ballroom from 5 to 7.
Fantastic. Well, I hope everyone can show up for that and learn more. And I'm really looking forward to see what else we see the X coding go on, because it makes a lot of sense that this should be something that's more broadly adopted. Well, thank you guys both. This was a lot of fun. And we'll kick it back over to the end of the session.
Thanks for the opportunity.
Thank you.